Good morning, 102.7 and 103.5 WICY. Feel-good favorites from the 80s and more. Right now, stopping inside the community with a valued member of our society right now when it comes to being a part of the front lines, Dr. Todd Whitman with the Alice Hyde Medical Center. And who else are you also with, Todd?
The CVPH Medical Center and the University of Vermont Health Network.
And how busy have you been lately?
It's been pretty crazy these days, but we feel like we're making lots of progress, and we're in a good place here at Alice Hyde to accept this infection as it comes our way. We hope that it doesn't, but we're ready.
I think we're doing the most. And I don't know if it's just the volume that makes it hard to control in the larger areas, but it seems like the rural, people in rural areas are really, sticking to it more than others in the urban areas. It's kind of crazy.
Yeah, I think Malone in particular has been really great about social distancing and, only getting out for essential visits to the grocery store and things like that. So hopefully we can continue down this path because we're certainly doing better than other counties when it comes to number of cases.
Right, and that's something to, I guess, applaud in something, the big picture that this is. Some people look at it, in a grim manner. I'm thinking, there's hope here, and we'll get to that later down the line here, Todd. But first off, Governor Cuomo, who's been great through all this, I just want to say, has had an executive order on medical equipment and PPE. Now, you're going to have to kind of dissect that for people who are listening right now.
Absolutely. So what Governor Cuomo's done is try to really utilize resources from around the state in areas that aren't requiring as much of the medical equipment as we may in the future, and try and share that with the folks that are in really troubling times, particularly downstate. And so there's two pieces to what you just mentioned. The first is ventilator care. So ventilators are machines that help us to breathe on when we're unable to breathe on our own. They're in limited supply around the country based on current needs. But what Governor Cuomo is trying to do is help the people downstate by us sharing some of that tool with them. They've put out very realistic asks and guidelines around what we might be able to contribute. We are working both with CVPH and other hospitals in the network, including Elizabethtown, to come up with a potential amount of ventilators that we can share as a group rather than Alice Hyde, CVPH, and Elizabethtown sharing those separately. So we think we've got a good plan. We certainly want to help people in other parts of the state as much as we can, and we're lucky right now to be in a position that we could do that to a small extent so that we can both keep our community safe and keep things on hand that we need and help put them in a better place. And the other part of that ask, John, is that they would do the same for us. So we all expect that the peak in New York City is going to come before the peak in areas like Malone. And so in the event that we don't have enough ventilators when it's our turn, they would share with us as well. So I think it's a great program. It's probably hard for people to comprehend and feel good about sending away such vital resources at this time, but it's a full circle event. We hope to get that back when we're in crisis.
No, we trust you guys on the front lines making the best decisions for us and also working to help save lives, whether it's directly or indirectly. So thank you. And real quick, we got a couple more topics to cover here in a few minutes. Mask guidelines through CDC and UVM. This is for the public and Alice Hyde employees as well. These masks, real quick, I heard it's not so much the people that don't have the virus wearing them not to get it, but those who somehow don't know they have it, and they're not, spitting it out there, I guess is the way to put it.
Right, exactly. So there's two different avenues that we talk about. One is cloth masks, and cloth masks, they can be homemade or purchased, are to help prevent the spread of the virus. So if someone's an asymptomatic carrier, they don't know they have this, they can spread the virus without knowing it. And so the cloth masks help to protect the people around them. The second part is the PPE that you mentioned previously, and PPE is a mask, either a surgical mask or these N95 masks that you've heard so much about. And the purpose of those masks is to protect the person wearing them. So those are really for healthcare workers in most instances, and we've had lots of talk and changing guidelines around how to protect our healthcare workers as much as we can, and it's wide, so UVM Health Network wide guidelines that will be released within the next couple of days. They're more liberal, and I think our employees are going to feel much more comfortable with those than the WHO guidelines we've used previously. So we really feel like we're moving in the right direction.
Awesome. And Todd, we're going to let you get back to work here. We just want to give you an opportunity to say anything else that you feel is necessary right now.
No, I just want to thank Malone. It's a great community, and everybody's really doing their best to spread the word that we need to stay at home, limit trips to the grocery store and other essential visits that we have to get out to. And next time, I hope to talk about what telehealth is and how Alice Hyde's looking to connect with our patients online as much as possible.
Yeah, this is great stuff. We have topics to look forward to every week when we meet with you, Todd. Thank you.
Hey, well, thank you, John. We appreciate your time today.
Yeah, it's been a great series. This is Dr. Todd Whitman with us from Alice Hyde Medical Center, amongst some other great medical establishments as well. It's 1027, 1035 WICY. We are inside the community.